We have been talking a lot lately about the opioid crisis, associating it mostly with those down and out in the street. But you're hearing commercials all the time now, constant warnings about fentanyl. We have the provincial government buying airtime. This is such a serious issue. Buying airtime saying, don't do drugs alone.
You can't see it, you can't smell it, but it could be in the street drugs you're doing.
Right.
Yeah.
And it's invading all walks of life. One who came back from the brink and is on a campaign to bring more light to the discussion is Darryl Gebien, a former emergency room doctor who hit rock bottom in 2015. It has been a long climb back after spending 8 months in jail. He's joining us this morning. Good morning, Darryl.
Good morning.
Good morning.
Tell us what happened to you.
Try to make that in as quick as I can, but I quickly became addicted to Percocet after some back pain in 2008. Although I did take made some bad decisions at one point where I decided to take it when it wasn't really needed. I noticed that when I took it, it took away my back pain, but it also took away a lot of anxiety and fears and stress. And I just kind of abused it one night when my friends had come over for some PlayStation golf, and from that moment forward, I just started the addiction spiral, and within a couple months, I started using it more and more, and eventually came to the point where I started using it to medicate my problems away, a crutch, if you will.
Yeah.
And from there, then it slowly spiraled out of control over about 5 years, and this is now addiction itself for me didn't happen in a vacuum. There were other problems going on in my life where I had some marital discord, family issues, a little bit more than your typical work-related stress. And combine that with the isolation as well. I had moved up to Barrie with my wife and kids and away from my social support network. And didn't really make any new friends up there. So these are the kind of the things I can see now in recovery that I didn't see then, that were transpiring to make my life even harder. And so,
but here you are, Darryl. Here you are. You're a doctor, a healthcare professional. Didn't you see where this was going?
No, I mean I'm human first and foremost. So, it's the issues going on in my life. I think probably that's probably what I should have sought treatment for more than anything in the beginning, along with this growing addiction. But the denial of my problems, I think, is a universal thing amongst people. It doesn't matter what you do for a living. I thought I just wanted to keep everything under control and working in my life. So, yes, there was a voice in the back of my head saying, Darryl, what you're doing is wrong. But it would just eventually, even though I might stop for a little while with time, and again, with some sort of stressor in some sort, I would end up going back to my old ways.
And then you moved on from Percocet to fentanyl. That's one of the things that we're talking about now. And you were working through all this, is that right?
Yes, that's right. So there came a day, the dependency on with the opioids, you built a person who uses more and more develops a tolerance. But to achieve the same effect, they require more and more higher doses. So this is how the addictions kind of spiraled and worsened over 5 years. So we got to a point in 2014 where I was going through withdrawal, and I had already experienced it several times before. So this was a major step. So just stepping back here, it was a major step because I didn't realize I was addicted. This is now going. I was at a point where didn't realize I was addicted until it was too late. So I didn't know that there was a problem until I woke up one day and I felt withdrawal. So that happened maybe a couple of years in. So then, fast forwarding now to 2014, I was going through pretty severe withdrawal from Percocet. And I grew desperate. And again, this is something where I'm not alone, where a person does what appears like to be crazy things to do. It's the only way I can make sense of it, because like I said the other day, I'm shocked by my own behavior, like what I did. But this desperation, again, is something that I'm not alone this way. And I made the decision to use fentanyl. I had a patch. I didn't have Percocet. I was feeling withdrawal. And instead of wearing the patch properly, I had searched how to abuse it. And from there, when I abused it by smoking a small piece of it, that was the beginning of the end for me with fentanyl. It was so strong, and things changed very drastically, and the spiral just sped up even more so after that.
So you were actually stoned while treating patients?
I wouldn't say stoned. No, there's no good choice of
Under
words
the
here.
influence?
Yes.
Okay.
So it's just, let me just explain this. So to avoid withdrawal, I would wear a patch. So to me, that would be a normal, steady state. So I'm not getting high. I'm trying to feel normal. So because my tolerance had built up so much. So at this point, and this is a desperate part of my life, and it's a lot of shame, that yes, I would wear a patch to avoid going through withdrawal because I wouldn't be able to function otherwise. It is so compelling and very, anyone going through opioid withdrawal, it becomes extremely desperate. I mean, this explains why there's so much crime with break-ins, theft, robbery, manipulation, prostitution. And in my case, a doctor who prescribed took advantage of what I could, and I took advantage of my ability to prescribe.
Okay, now, former emergency room doctor, because obviously they pulled the plug on that. You spent 8 months in jail. Darryl Gebien is on the line with us. Are you saying that you were able to do your job properly while you were wearing that patch because it brought you to a, quote, normal state?
No, I mean, obviously, like any physician or healthcare professional who is, under the influence of any sort of mood-altering substance, I would call that an impaired healthcare provider. Mm-hmm. So there's no question about that. That being said, that my own addiction is, this is a specialist physician, and he's not alone when he says this, that one of the last things that goes with a healthcare or any professional when they're at the end stage of addiction is their actual professional skills. So I'm not trying to say that to cover this up and make it look pretty, but what the addictionist says is that one of the last things to go is their profession, because everything relies on that. And so these are skills and knowledge that is developed over many years to be a professional. It's one of the last things to go in an addiction because the user in the situation is doing everything to protect themselves and to protect their developing worsening substance abuse. So their skills are, they maintain their skills because everything trickles down from there. If they lose their skills, they've now become in the crosshairs, I guess, in their profession. And so, that's what he says. So I'm
okay. Let me just ask you this, because we just Darryl, have a couple of minutes left here. But you were found out. And there was a knock at the door. How were you found out? And were you thankful that somebody knocked on your door and said, "This is it"?
In the end, yeah, being arrested saved my life. That's the bottom line. In the end, it was me that gave up. So it's not that I was reported. I was the one who gave up. And
you just said, "I can't do it anymore. I need help." Is that what happened?
I mean, this was the worst possible situation, and I know there's a lot of other people out there, substance abusers, who are in the same situation, that they grow so desperate. They know what they're doing is wrong, but they are just slave to their drugs. The opioids are so strong in this way, and maybe the only one I could think of is crack cocaine, but the opioids puts a person in a situation where the spiral, like I said, it gets really ugly. So I was in a desperate situation. I'd lost a lot of weight. My whole family was worried sick about me. I knew I was not in good shape. I couldn't hold it together. So there's a day where I basically gave up. It wasn't so obvious, like a movie moment. It was just a subtle little thing that I had done when I went into a pharmacy the last time to fill a prescription. So so now we're fast forwarding a couple months. So after rehab, I relapsed, and then I wasn't quite ready. I was sick as a dog after rehab, and again, no excuses, but a relapse sometimes is a part of recovery for people. Mm-hmm. And January 19th, 2015, I got a knock at the door, and this is when it was the police, I think the Barrie Drug Squad, and that was the day my life changed.